Well, welcome to this talk, and we're carrying on thinking about last week's debate in Parliament about excess deaths started by Mr. Andrew Bridgen. Now, the contribution I want to think about today is from Mr. Neale Hanvey, who's the Member of Parliament for Kirkcaldy and Cowdenbeath in Scotland. Now, he says, I'm going to go through some of the points he makes first because the amount of time given for this debate was ludicrously short. An hour and a half, despite all of the excess deaths. So members had to speak really quickly, and it's hard to make him out. So just because he had to talk so quickly. So I'm going to go through some of his points before we look at his speech. He said he wanted to focus on the safe use of novel mRNA agents and on concerns over their alleged role in driving excess deaths. And he did, in fact, work for the health service for 25 years, took part in clinical trials, worked at the same institution as Angus Dalgleish, Professor Dalgleish, who's been on this channel, and has contributed towards medical textbooks. So Mr. Hanvey is a healthcare professional. He says this, politicians who dismiss the data and emerging clinical evidence are acting in a wholly irresponsible manner and posing a real threat to the duties of honesty and candour at the heart of good clinical practice. And listen to these words. If sustained, the concerns surfacing around falsified or concealed data are the most serious I can imagine. Good clinical practice is a set of international recognised ethical and scientific requirements which must follow the Declaration of Helsinki on human experimentation going back to 1964. He says this, the foundation of good clinical practice is under threat. Very strong words. Pandemic management requires societal coordination, global orchestration, respect for human rights, and defence of ethical principles. And I think there's serious question marks over all of those in the COVID response, for example. Yet some approaches to the COVID pandemic, driven by societal, corporate and political interests, have undermined key pillars of ethical medical science. So if substantiated, this is really quite significant that socio-economic, corporate profit, companies making profit, and political interest may have undermined key pillars of ethical medical science. None of these clinical experts are quacks or conspiracy theorists, so we're dealing with people of the highest calibre who are raising these questions. Heck, the people we've interviewed on this channel are of the highest calibre, leading professors and doctors from around the world. As the government said so often during the pandemic, we must follow the science. So I just wanted to unpack that a bit now because time is very limited. Just to point out that everything I've said there, he did actually say, let's listen to his brief speech now.
So I want to start by paying tribute to the Honourable Gentleman from North West Leicestershire for his courage and determination on this important matter. And I also want to challenge the Honourable Member for Knowsley on his assertion that they were so-called experts at that meeting. They are world-renowned experts in their field. That is just a matter of observable fact. This morning I want to focus on the safe use of novel mRNA agents and concerns over their alleged role driving excess deaths. I should repeat at the outset a point that I have made previously in this place and directly with the Minister, that any agent has the potential to cause harm or injury to the subject. For the avoidance of doubt, the position that I have taken is based on decades of involvement in the management and delivery of clinical trials. Politicians who dismiss these data and emerging clinical evidence are acting in a wholly irresponsible manner and pose a very real threat to the duties of honesty and candour at the heart of good clinical practice. If substantiated, these concerns surfacing around falsified or concealed data are the most serious I can imagine. But I have worked in the same institution as Professor Dalgleish, and his credentials are impeccable. Politicians who dismiss these data and evidence are acting, as I say, in a responsible manner. This is necessary because these are the standards on which good clinical practice is based. Good clinical practice, or GCP, is not about a nice bedside manner and knowing what treatment to prescribe. It's a set of internationally recognised ethical and scientific requirements that must be followed when designing, conducting, recording and reporting on clinical trials that involve people and have their origin in the Declaration of Helsinki. The rights, safety and well-being of trial subjects are the most important consideration and should prevail over interests of science and society, including commercial or political interests. So I will conclude with this reflection on that important principle. The foundation of good clinical practice is under threat. In their December 2023 Pathology Research and Practice paper on gene-based COVID-19 vaccines, Rodeza and Parry gave the following warning. Pandemic management requires societal coordination, global orchestration, respect for human rights and defence of ethical principles. Yet some approaches to the COVID-19 pandemic, driven by socio-economic, corporate and political interests, have undermined key pillars of ethical medical science. None of these clinical experts are quacks or conspiracy theorists. As the government said so often during the pandemic, we must follow the science.
Well, it's great to see more members of Parliament taking these issues really seriously here and not mincing their words. Now, excess deaths are continuing in the UK and around the world. So not only do we need to know why people have died excessively in the past, we want to know why people are dying excessively now, because we want to stop these excess deaths for the future. Thank you for watching.